Japan's Prime Minister Shinzo Abe has announced he's extending his country's COVID-19 state of emergency until the end of May. Much of Japan has been under lockdown restrictions since the 7th of April, with people told to stay at home if at all possible. Our correspondent Rupert Wingfield-Hayes sent us this update from Tokyo.
There's no real surprise in this announcement. It's been expected for the last few days. But what it means is that most of Japan will remain in this state of emergency for pretty much another month. Some places with very low rates of infection may be allowed to loosen a little bit, open public libraries, open some public facilities and parks. But places like Tokyo, Osaka, the big urban areas in Japan will remain under this state of emergency, under this advisory for people to stay home if at all possible. It's not the sort of shutdown we've seen in Europe and America, but nevertheless, everything has slowed down here dramatically in the last few weeks. And of course, that's affecting the economy, hundreds of thousands of people out of work, staying at home, not able to earn a salary. So this extension of another month is bad news for all of those people, bad news for the Japanese economy, but it is deemed necessary by the scientific advisors who are advising Prime Minister Abe and his cabinet. Now, the reason is that the number of infections is still considered to be a threat to the Japanese healthcare system. If you look at the raw figures, Japan looks like it's doing really, really well. 15,000 infections confirmed overall, around 550 deaths so far. That is way lower than most countries that have been badly affected in Europe, the UK, North America. But it is the ratio of infections to beds and ICU beds in particular in hospitals that are able to deal with sick people. And what we've seen in the last few weeks is Japan does not have much capacity for intensive care units, for ventilators, for the sort of PPE that is needed for doctors and nurses to treat COVID patients. And just a couple of weeks ago, here in Tokyo, the healthcare system looked like it was getting close to the point of being overwhelmed. And that's really why the experts are saying this order needs to remain in place longer.